concerning the concept of person-centered medicine. We are trying to say that this refers to a medicine of the person, meaning of the totality of the health of the person, including both ill health and positive health. A medicine for the person to contribute to the fulfillment of the life project of every individual. A medicine by the person, where we clinicians extend ourselves as full human beings with scientific competence and high ethical aspirations. And last but not least, a medicine with the person in respectful and empowering collaboration with the person who presents for care. Professor Sharma from India once remarked, very relevant to your question about the concept of person-centered medicine, that in our field, in medicine, science is essential, but humanism is the essence. Fact is that modern medicine has achieved magnificent feats in the past decades in terms of growing knowledge of the basis of disease and new techniques for diagnosis and treatment. But at the same time, it has suffered for its heavy emphasis on organs and disease, to the detriment of the view of the patient as a whole person. A whole person who has not only illness but also positive health. A person who has a history and a future. And this distortion of medicine is decreasing the opportunities for medicine to fulfill its role of enhancing the health and life of people. I think there is growing awareness now in the world that we must refocus medicine from just illness to a broader concept of health. And that this is a task for all components of society and for each individual assuming responsibility for our initiative on person-centered medicine. We can say started during the period of my presidency in the World Psychiatric Association, when meeting with the presidents of the World Medical Association, the World Federation of Neurology, the World Organization of Family Doctors, we started conceptualizing a concept of person-centered care that could extend to the whole field of medicine. Then we were gratified to see, as we started organizing our annual conferences, with the interest of other health organizations, principally the World Health Organization that has officially sponsored the Geneva Conference during the past 3 years, as well as the International Council of Nurses, the International Federation of Social Workers, the International Federation of Pharmacists, and the International Alliance of Patients Organizations, as well as family associations. In such a way that from the 10 institutions that originally sponsored the first Geneva Conference in 2008, we had in the latest one, in May of 2012, 33 organizations, including 10 universities. But our main event has been and will continue to be the Geneva Conference on Person-Centered Medicine, in close collaboration and geographical proximity with the World Health Organization and the World Medical Association, as well as International Council of Nurses and other health institutions based in Geneva. The latest one has, for the first time, produced a Geneva Declaration on the main theme of the conference, namely person-centered care for chronic diseases. And this is a procedure that we plan to continue to extend the impact of the conference. Another set of events that we plan to organize are the international series on conference and publications on specific clinical issues dealt with in a person-centered manner, as well as a series of international congresses that we plan to also organize periodically. Perhaps the first one in Zagreb next year. Another major activity has been the launching of our journal, the International Journal of Person-Centered Medicine, in collaboration with the University of Buckingham Press, which recently achieved its full first year of publication and already has completed a second issue, quarterly issue, of the second volume. And a number of research activities that are trying to bring about methodology for the implementation of the concept of person-centered medicine in healthcare. One of them is a project on person-centered integrative diagnosis that now is moving from a theoretical model to a practical guide, as well as guiding principles for person-centered care that has already been received attention for a couple of Geneva conferences, and that now the World Health Organization would like to take the lead in producing official world guidelines for person-centered healthcare. We are also starting a research project with the World Health Organization on the systematic conceptualization and measurement of progress towards people and people-centered care. So, and we see our perspective as a journey where at every step we'll try to refine our views and develop increasingly effective methods to bring about person-centered medicine as a fulfillment of our vocation and of the expectations of society in the field of health. We started this adventure in 2008, so to speak, without any certainty that this was going to continue. We didn't know if there was going to be a second Geneva conference the following year. But every year there has been increasing interest, larger number of societies, increasing number of universities joining this process, groups of scholars from almost every corner in the world that are contributing to the Geneva conference as well as to our journal. We see also in many countries increasing discussion at a public level of how to enhance clinical care in such a way that it could be more effective than it has been. And perhaps moving from a distorted view of medicine just focused on organs and disease to an integrative view of medicine which takes into consideration the whole person of the patient and the families and the clinicians in such a way that using the tools of science and all modes of understanding a complex reality, we could develop effective procedures to fulfill our personal goals and the goals of society for better health and a higher quality of life. I could say that I started my career in medicine as a student in Peru, where I was born, the son of a Yugoslavian father and a Peruvian mother, with a hope of being able to deal with the intellectual complexity of life. And that eventually led me to go into psychiatry as a particular specialty that I consider the most complex and rich one. But I will say that gradually over the years, this intellectual goal has been to some extent overcome by a concern for care for my patients and for human beings more generally. And presently, I feel privileged to have the opportunity to work on the refinement and increase effectiveness of this concept, to which I hope to devote the rest of my life as a contribution to improving the health and life of people in the world and my own health and life.